welcome to RAAONLINE. Myself, Dr. Rahul, and today we'll discuss about the blood management. Okay, so before going to the blood management, we can see the questions in the DNB exams. Suppose these are the questions that can be asked. These are all the theory questions. Point of care coagulation monitoring is a question of 5 marks. Discuss the importance of blood substitutes, thromboelastogram, ANH, autonomic normovolumic hemodilutions, blood components therapy. Draw a well-level diagram of tag and ROTEM. We'll discuss everything. Clinical application of different forms of tag in anesthesia practice. What is the point of coagulation testing and its importance in the perioperative period? Blood components and its use. Oral direct kinase inhibitors. This is also known as novel anticoagulants. Define transfusion-related acute lung injury or TRALI. Discuss its pathogenesis and management. Define massive blood loss and enumerate the methods of blood conservations. DVT prophylaxis. Allowable blood loss during surgeries. Acute traumatic coagulopathy ATC. Damage control resuscitation, ROTEMs, massive transfusion protocols, chronicle changes in the stored blood, pathophysiology of disseminated intravascular coagulations. So around 20 questions, but these questions are going on repeating every year. So mostly I have collected these 20 questions from last 7 years of paper of the DNB exams, and I try to cover most of these questions in my further discussions. Okay, so from the blood chapter, maximum time in the OSCE and in the theory paper it will cover. Viva they will hardly ask about massive blood transfusion. Unfortunately, if a candidate will get this head trauma or the ATS patient, then they are going on asking about bloods. Otherwise, in theory question, hardly they will going on discussing about massive blood transfusion protocols and things related to blood. Okay, but it is very much important for the theory, and it is very much important for the OSCE. Okay, let us start. So here you can see we will start about the blood management. Okay, so here suppose this whole blood. Now we are discussing about the answer, that is the what are the components of the whole blood. Okay, scoring 5 marks question. If you write this type of diagrams in the exam, you will get a good marks. Okay, so when whole blood it is centrifused, we'll go to platelet release plasma, so are called as PRP. Okay, out of this we can get packed cells, and we freeze for minus 80 degrees Celsius, we get frozen red cells, and also we can get leukocyte reduced red cells. So whole blood, packed cells, frozen cell, leukocyte reduced blood cells, platelet release plasma. When we centrifuge for again 20 degrees Celsius, we get the platelets. So the platelet release plasma will convert into platelet poor plasma. Again, when we freeze for minus 20 degrees Celsius, we get the FFP, that is known as fresh frozen plasma. When we freeze for minus 70 degrees Celsius, we will get factor 8 poor plasma. When we thaw it, we get the cryoprecipitator. Cryoprecipitator individually comes as a 2 marks questions. Okay, so here in single slide, see how many questions are there. So what are the components of the whole blood? Easy questions. Cryoprecipitate, easy questions. FFP also easy questions. What is the criteria or what are the conditions if we transfuse blood? Easy questions. So here so many questions in the single slide only. So the components of the whole blood are very much important. It repeatedly comes in exams. Okay, so now we discuss the biochemical changes in the stored blood. It is also a 5 marks questions. Okay, so the blood are stored in mostly CDPA, that is citrate, phosphate, dextrose, adenine 1, or simply CPDA is anticoagulant preservatives. It is mostly stored in 1 to 6 degrees Celsius. It is a MCQ. Okay, 2 to 8 degrees Celsius, 8 to 10 degrees Celsius, 10 to 12 degrees Celsius. The answer is 1 to 6 degrees Celsius. The citrate prevents the clotting by binding calcium. Phosphate serves as a buffer, and dextrose serves as a source of energy. So citrate is actually binding to the calcium. It will provide it will decrease the calcium level and prevents and helps in anticoagulations. This phosphate will help in the buffer, and this dextrose as a source of energy. Okay, fine. Adenine prolongs storage time by increasing the survival of the RBC, allowing them to resynthesize the ATP need for the fuel metabolic reaction. This extends the storage from the 21 to 35 days. When we add adenine, it will provide the extra source of ATP and will increase the storage from 21 days to the 35 days. The self-half-life of the PRBC extended. Self-half-life of the PRBC extend to 45 days with the use of Adsol or AS1, AS3 and AS5s. Okay, but it is hardly used. Mostly we are going in exam, we will ask about this CPDA1, or we will ask about the function of what is citrate, what is the use of phosphorus, what is the use of dextrose, and what is the use of this adenine. But for the additional, In some exams, they may ask to prolong the storage. What is used? So AS1, adsol leukin 1. What are the components in the adsol? It contains adenine, glucose, mannitol, and sodium chloride. So this mannitol, it again has an antioxidant property. It is again have osmotic property. So by using this mannitol, we can prolong the storage from 35 days to the 42 days. Okay.